All right, now before we scan, the first thing we want to do is we want to make sure that we are on the appropriate arch. So we're starting with maxillary, mandibular, then we're going to move on to the bite registration. Now, the recommended scanning method is to start with a molar, since it has greater details for easier identification. Change the scanning angle to less than 60 degrees during scanning to allow the surfaces to overlap. If the overlap is too small, the alignment may be lost. So remember, we're starting with the maxillary, so you want to be consistent. So we're going to start on the upper right, number 1, 2 area, then we're going to work our way across. Go ahead and open for me, please. And now we want to make sure that our surface is dry, because if you try and do this when it's wet, there's a chance that you can get reflection. So taking our scanner, we want to keep this parallel to the tooth. Remember, we're starting on the upper right, so we're going to hit this button once we are ready. Open for me, please. Good. We want to make sure we keep that parallel, and we can hear that chime for our scanner. If for some reason the chime stops, the scanning stops. Now, the recommended scanning protocol consisting of 3 sweeps, the occlusal, lingual, and buccal, to ensure good data coverage of all surfaces. It is recommended to start the first sweep from the bite surface. If there is a preparation, start with the preparation so that the gingival area can be scanned before the gum collapses. If there's no preparation, for example, in orthodontic cases like this one, you should start with the first molar. The second sweep can scan both the lingual and buccal sides. So in this case, we have our occlusal. So now we're going to move to the lingual. And we have a nice consistent, there we go. See our beeps pausing for us? Like I said, when that beep pauses, the scanning pauses. So keep that in mind. If that's the case, then you have to go back to an existing area that it's familiar with to start again. And you can see from the scan that it caught a piece of my glove. So I'm actually going over that to ensure that it's getting rid of that. You can see there it paused because it lost what it was familiar with as far as going into session. So I went back to an existing point to start over. All right, and then of course we're back here on these molars. Sometimes you might have to apply a little bit of pressure to push that tissue out of the way to ensure you get everything that you need. So now I'm coming back, just trying to catch these incisal edges. One final sweep. Get rid of those gloves. Okay, now we're going to turn off, and we can see right now that it's going to refine our scan for us. So there's our scan. We can look around. Okay, then we're ready to move on to the mandibular. All right, now we're ready to start the mandibular. You can see that our tab is highlighted here. Go ahead and open for me, please. Same thing, we're going to start on the molar, same side. I'm going to start on the right side, occlusal, and I'm going to stay parallel about 1 to 2 millimeters above. I'm going to get that lined up, press my button, and my scanning starts. Go ahead and open for me, please. There we go. Make sure we're able to get all the way back here. And then sometimes you might have to do a couple sweeps to ensure that you're getting all that occlusal and incisal edge. Open again, please. Especially those second and third molars. Okay, then we're rotating to the lingual. All right, so we've finished our mandibular scan. So now we're moving on to our bite. Now for the bite registration, what we're going to do is we're actually going to place our scanner, have our patient bite down, scan one side, then the other. Open for me, please. Excellent. Okay. Now go ahead and bite down. Make sure that your patient is biting down correctly. Keep your bite together for me. And now we're just going to sweep along the surfaces distal to mesial. You can see I'm not starting it yet, but you can see on the scanner, on the screen, the movement that we're trying to replicate. Okay, keep your teeth together for me. Excellent. Okay, and our bite is captured. Great. Okay, now we're going to go to the other side. So left side. Bite again. Excellent. Okay, and our bite is captured.